morning, Brendan. This is Molly. How are you?
Hey, good morning, Molly. I'm doing well. How are you doing?
Good, thanks. Yeah, we got the two rooms set up, but give us a few more minutes. We'll let you know when we got everybody in.
All right, that sounds great. Thank you.
Okay, thanks. Okay, Brendan, we are ready to begin. Thank you.
Okay, great. Oh, no problem. All right, well, my name is Brendan Cole. I'm an RN and implementation manager with Care Efficient. I'm going to kind of go over the overview of a patient chart and just kind of get started on our training. We'll do more of your day-to-day stuff on that next training. So this is the online home screen. It's ams.careefficientinc.com. This login screen, your org code will always be the same number. It's going to be LMVH3106. Your username will either be your first initial last name or your email address typically, depending on if you had an email address attached to your associate file when they gave you web access. You'll enter that information. Now, if they did give you if your email address was entered under your associate profile, when Livingston gives you web access, it's going to email you a temporary password. I just recommend copying and pasting that password into this field. It just works a little bit better that way. That first time you log in, it will ask you to re-enter that temporary password and then enter your own personal password that it's going to ask you to create. If you forget your password, or let me back up. If you do not have an email address and your username is your first initial last name, then more than likely the administrators are going to have to set up a temporary password for you, and they'll just have to give that to you in another way. If you do have an email address attached to your associate file and you do forget your password, you do have this forgot password link, it'll ask you to re-enter the org code and your username. And then that will email you a temporary password. Care Efficient doesn't reset user passwords, only administrator passwords. So if you are having trouble logging in with any of these ways, you may need to or if you've gotten locked out, talk to your administrators about resetting that. You're not going to see the little
Brendan?
where you have to reset. Yeah.
Is there any way you can make the screen a little bigger like you did yesterday?
Yes, I will. Now, just be aware, when I do make my screen bigger on my end, it'll look better on your end, but on my end, it is a little bit harder to navigate, and sometimes those pop-up windows may show up in different places, so just be aware of that. So it does not show you, I did not, no problem. And this is probably about as big as I can get it. I'm sorry, I lost my train of thought. When you first log in, again, it's gonna ask you to re-enter that temporary password and create your new one. It skips that screen because we've already set up the password on this clinical trainer associate. So when you log in, this is your home screen, the landing page, and over here on the left, you can see announcements columns.
What happened?
Care Efficient will put out announcements. And your agency administrators can also put out announcements, so I do recommend reading these. We do have lunch and learns and things, and all of our update releases.
I don't know what happened.
We do a lunch and learn for you. I am going to mute some lines, so if you guys need to ask questions, go ahead and unmute yourself. I'm sorry, there's just some noise. All right, so you may occasionally get some pop-up announcements also. To not see those or view those again, there's going to be a little checkbox in the bottom that says do not show again. Be sure and read them. A lot of them are CMS announcements if they're having dark days or, if Care Efficient's doing updates and enhancements. We do those every other Thursday, sometimes, every Thursday, just depends on how many we have going out. And usually they're at, I believe, 9 p.m. 9 p.m. Eastern time at every Thursday or every other Thursday, but we will put out an announcement. The only thing I recommend is if we are going to do enhancements or upgrades, probably it would be just better to save your work right before that time. It usually only lasts about 5-10 minutes. You may or may not have any issues at all, but I would not want you guys to lose any kind of documentation, especially if you worked on it for a long time. So save your work before then, if anything, so you don't lose any data. So read these announcements. When you clear out those pop-up ones, you'll see them over here in this column as well, so you'll always be able to look back at those. There's also, you may have, now some of these options may not be available based off your role, so you may not see invoices or associates, but I'll go over these real quick. There is a reports and options link for all the different reports that we have in Care Efficient, and if you click on the little icons next to those reports, it'll tell you information about that type of report. You won't need to worry about the CVV access. The schedules, you can jump to different schedules if you want to search schedules. You can also jump to different patients from right here. Again, you won't see invoices or associates or should not. And then you also have the links to go to these patients and schedules by coming up here to the patient menu up at the top, and you can go to patient encounters and go to their schedule that way as well. Okay. It is going to default to your calendar here. You are going to see all the visits right here on your page. I am going to, let's see, find that home health patient. Let me just go to this patient encounters and filter. And you don't have to, I'm going to go back over how to get to this area, so don't worry. I know I'm jumping ahead. I just wanted to make sure I had a visit on here so I can show you guys. Do for yesterday. Okay, so you can see that we have quite a few visits on here for all these test patients. You're going to see all the visits here, and then when I come back to this, I'm going to show you how to add a service note. But first of all, I want to kind of show you what those encounters look like, and an easy way to get to them. So if you click on your patient's name and visit on your calendar, you're going to get a few options here. This is how you're going to add your service notes in your OASIS integrated assessments, and we'll come back to that in a minute. But you can also go to the patient encounter or patient schedule here. So this is really helpful in just going straight to it. But if you click on the patient encounter link, it will take you to this patient's encounter. Up at the top, everything up in this kind of little gray area is going to be visible no matter what tab you're on down below. And up there, you're going to have the patient's name, patient's phone number. If you hover over the little address books there, you will get the patient's address and phone number. And if they have alternate addresses and additional phone numbers, you'll see those listed here as well. Otherwise, you will see their preferred phone number right here. You will see the primary physician, and the physician, if it was a real physician, would have a phone number there as well. Once we start adding information to this encounter, we will have the allergies listed up here. You may have special notes that are listed up here. Those would be important notes. If you click on the little icon, if there's more than one note, you'd be able to view all that information. You're going to see, of course, the agency's name, the start of care date. Primary diagnosis would be listed here. To view all the rest of the diagnosis, you can click on this little magnifying glass, and you will get, you will see all the diagnosis for this patient. The disaster level, once it's added, will end up displaying up here, advanced directives, the status of the patient, if they're active, hold, pending, if they're discharged, or if they're non-admit. You're going to see all those statuses up here. If they are discharged, you will see a discharge date in here. You'll see the date of birth, DNR status as well. So all of that you'll be able to see no matter what tab you're in down here. Other options that you have up here, these are going to change based off the status. So since this patient is active, we do have the option to discharge the patient, place the patient on hold. You can print a patient fact report, and you can include all of this different information, such as the physician's patient context notes. You can include whatever you'd like, and you can display it in the portrait or landscape, whatever works best for you. And you just hit export, and it will create a PDF file with all of this included information. And to get to the patient's schedule, there is a scheduling link up here. This one's pretty important. So if you do need to see the patient's schedule, when you're going to see him again, or another clinician may see him, you can click on this scheduling link, and it will come to their schedule. And we'll come back to that in a little bit. All right, so now let's go through these tabs. The patient profile tab. And I'm just, excuse me, I'm muting all these lines where people are joining. The patient profile tab under the personal side, this is the patient basic patient demographics, their name, date of birth, etc. You can edit this information if anything is incorrect and you find a mistake. You can choose the edit button and correct that information. There's also under the current encounter, this is going to be tell you about this encounter. So if the patient, this is the first time this patient's been on, so it shows it as encounter number 1. If they're discharged and readmitted, it will increase to the number 2, and so on and so forth. Of course, the verbal start of care would be different for each of those encounters. The residents could be different, referral source information, all of this could be different. So that's why we have this on each encounter. This that's pretty much it for the patient encounter or profile tab. If there is any missing information, such as a patient address or anything on this profile tab, you'll also see where it'll say missing information, and in red font you can say, it would say what's missing, you know, their address, their primary physician. If anything that's required is missing, you can just click on those links. It takes you straight to where you can add that information back in. The contacts tab on the left side, this is going to be all the patient information, so their home address, their phone numbers. You'll have all that information right here. On the right side is patient contacts, so this is going to be their next of kin, power of attorneys, things like that. And the way to add those, it'd be to click on the Add Patient Contact, and then you're going to have to choose all this information. Now, the orange asterisk is the bare minimum you need to move forward. So you do need to pick a relationship and enter their first and last name, and then you can choose a type. If they're going to be the primary caregiver, caregiver next of kin, et cetera, you can choose what their type they are. That part is not required. Date of birth is not required. You would hit continue after you enter that first and last name in the relationship, and then it'll give you the option to add their address or phone numbers if you just need their phone numbers in there. Really helpful for coordination of care. It's not required information, but it does help you guys out. The Notes tab, this is where you're going to see different internal communication notes about the patient. So there could be different things like scheduling notes. There could be COVID-19 notes in there, directions. We've added some extras specifically for your agency, so event note, night triage note, etc., telephone note. There's also going to be some automated notes that show up in here. So if anything's ever faxed out of this encounter, like a med list or an order, or if anything's uploaded into this encounter under the Documents tab, then you're going to get an automated note telling you who did it, when, and what that document was that was sent or uploaded. So to add a note, you just click on the Add Note link right over here to the left, and then choose what note type you want to add, and then just enter the information into that little box and hit Save. And then you'll see that information here. Okay, there's also ways to filter to specific note types. So if you just want to look for the general notes or the directions, because you could end up with lots and lots of notes in this tab, it may be easier to filter down to just that specific note type. And you can also filter for a specific date range. So if it was, the previous certification period that you're interested in or something like that, you can put the to and from dates in there, and it'll filter down to those notes that were entered during that time frame. You can deactivate a note if it no longer applies or if it was inadvertently added to the wrong patient's encounter by clicking on the little notepad with the X icon, and that can deactivate the note. You can also view deactivated notes by hitting Show Inactive and hit Search, and then those notes would come back or be visible, but you can also hit this little back icon and it will reactivate that note. You can also search keywords. Those keywords are going to search the verbiage you entered in that note section. And these can be exported as well. The Referral tab, on all your new admissions where their start of care starts in Care Efficient, you will see a Referral tab. On all of those transition patients, so the ones that are on service now that are transitioning into Care Efficient, you will not see a Referral tab on those. Intake, it will enter this referral information, and you'll be able to view this information here. They also have the opportunity to print this referral order, fax it, and then upload a signed referral if you guys end up having that. It'll identify the referral source, order tracking, as far as sending and receiving this referral order, because it is not under the Orders tab with all the other orders you're managing. And then you're going to get this referral information, so they can enter different physician orders, surgical procedures, nutritional requirements, DMEs, referring diagnosis, et cetera, and medications. Now, this information does not flow anywhere else in the encounter. This is only for this referral information, for this referral order. You'll see the referral contact information here as well, so if you guys needed to contact that referral source to follow up and get information from them, you'd have that information here as well. The Physician Facility tab, this is where you're going to identify all the physicians. The one up here at the top is the primary physician. Then all additional physicians involved in that patient's care will be listed down below. They do need to be added to this Physicians tab before you can ever send and receive orders from any other physicians. So make sure all physicians are added that are going to be involved in that care. To add a physician, you'll come up here to where it says Add Physician. Click on that. You can enter their first or last name to search, and then click Search. Or you can leave it blank, and it'll pull up every one of the physicians in there. And then just put a check box next to the physician you want to add. The sequence, it doesn't really matter other than the first position is your primary physician. So that's the MPI that's going to flow to your OASIS, and that's where all the orders are going to default to initially. So that's the most important position. If they're second, third, fourth, none of that really matters. It's just going to display their name in that order. And you can also identify what type of doctor they are. It is not required, but you can identify that. And then you would hit Save, and it will add that physician to the encounter. You can move these physicians. If this one was meant to be the primary physician, you can move them to the top, and it'll move that other physician back down to that second position. So you can rearrange these if you guys needed to. Over here on the right side of this tab, there's the last facility stay prior to start of care. Again, this is just coordination of care, so you can identify where they were discharged from prior to going home. And you guys can just identify that location here. The Documents tab, there's a few things you can do here. We do have electronic forms like consents and agreements, incident reports, things like that. To add a form, you just click on this Add Form link, and then see how my pop-up window moves down. It's because my screen's so big. You can pick which one applies. We do have your standard OASIS, or excuse me, CMS Medicare forms like your ABNs, HHCCNs, NOMNOCs, all of those types of forms are going to be in there. There could be consents again. Just to show you how to enter, you just pick which form you're looking for. Hit Continue, and then you're going to come into the edit mode of this form. So it's going to be similar to how your service notes look as well. So you just fill everything out appropriately. Once you get it filled out, you are going to do apply signatures, and it depends on how the form is set up, if there needs to be a patient signature or not. But you'll hit apply signatures, and it will gray out this information. So you won't be able to edit unless we remove the signatures and re-sign it. So just be aware of that. So if this is a form a patient does need to sign, after you hit apply signatures, you'll click on the patient or responsible party signature, and it will bring up a little pop-up window for that person to sign in. And then you just choose accept. Do the same thing with the agency representative. That would be your signature. Now, anytime you sign anything in the system, whether it's an order, one of these forms, or a service note, it is going to automatically pull your name and credentials from your associate tab and create this real pretty cursive, legible signature with your full credentials. Now, if you use this electronic signature, that's fine. The very first time you sign anything, this little box down here at the bottom that says, okay, I'm sorry. Let me open up this chat, by the way, because I can't see those. All right, so the very first time you sign a form, like I said, it's going to generate the signature. If you don't like that, you can clear that out and draw your own signature with your credentials. Of course, it should be legible. And then you would choose accept. And then as long as this is checked that very first time, save my signature for future use, then it's automatically going to pull up the last signature that you used when you go to sign your forms or service notes or orders. So you would just choose accept. And then now it is signed. You can see, make sure you visualize the signatures are there before you try to complete the note. Now these signatures are time-stamped. You don't see it here in the edit mode, but every time you sign anything, it is time-stamped, and same for the patients. So while you're filling these forms out, we don't actually receive any of that information in our servers unless you hit save and continue, save and close or complete. At that point, that information gets sent to Care Efficient, and then we have a copy of that. So if you're filling out a lot of information on some of these forms and large narratives or anything like that, it might be beneficial to hit save and continue every now and then, just so you don't lose any documentation if there's some kind of a glitch. Again, if you need to work on this later, you can hit save and close. I'll just do that to show you how you can get back into the form. And you'll see this form is added, and it is in an incomplete status. If you needed to delete it, if it was entered inadvertently, you can go ahead and trash can it at this point. But otherwise, you'd click on the edit pencil, go right back into that order or that form, finish filling it out, apply the signatures, and then when you're done with it, you're going to come up here to the top and you're going to mark it as complete. Once you mark it as complete, you'll see that it changed the status to a completed status. And you also have the little icon or the printer icon. You can print this form or just click on that. It will open it up in a PDF format. And it just depends on your browser settings if yours will automatically open when you click on it or not. Sometimes it will download. It just depends on the file type. But you would be able to print this, fax it, do whatever you needed to do with this form at this point. Some other options that you have with the forms is you can add additional signatures. So some agencies use like case conference forms in here, and then they'll have everybody that attended the case conference come in and sign it after it's been filled out. And then we do have the option to remove those signatures as well. The documents down here below, this is where they're going to upload anything that's involved with this patient record that wasn't entered directly into Care Efficient. So, lab results that you may have looked up and printed off, referral order that came over on the fax machine. The office would scan it in and add it to this document section. You can click on the check boxes next to multiple files and download them if you wanted to. Or if you just want to view the single file, you can click on it. Now, again, this is a document, Word document, so it just downloads it, and I'd have to open it with my Word on my computer. If it was a PDF, again, depends on your browser, but it should open it right up. But these are going to be anything that's related to this patient that needs to be here. You're also going to end up seeing, signed orders once the agency receives them back. They're going to be uploaded from the Orders tab, but you'll be able to view the actual signed order from here and print it off if needed. You'll also be able to view the orders in the system without the physician's signatures on them as well, and I'll show you guys how to do that.
Brendan, I just want to mention for everybody that the transition team that's transitioning patients from McKesson into Care Efficient are using this Documents tab and this section here to upload the information from from McKesson into Care Efficient. So any orders and things like that are currently in McKesson on a patient that will then reinsert in Care Efficient, you should definitely check out the Docs tab and the Documents section for information.
Okay. So yeah, that's there's going to be a lot of information in there. So this is a real important tab to be sure and look at. And that's pretty much it with this tab. There's the forms and documents are going to be there. Now,
okay. On the bottom it says mute, so I guess I unmute myself, right? No? Okay.
You're
okay.
unmuted right now. Did you have a question? Okay, I'm just going to go ahead and mute that line real quick. Okay, so on the clinical tab, on the transition patients, a lot of this information is going to have to be manually entered on your new admits moving forward, and after you get this information in, it just kind of keeps carrying forward through all the certification periods. Mute that one real quick. So on this tab, You can enter and identify case managers and their phone numbers, clinical managers. To add those, you could just click on the edit link right next to it. You can pick from the drop-down box who the case manager is, who the clinical manager is, and I'm just going to use myself for both of them and hit save. And then it will show their names and their phone numbers, and it's just going to help, you know, if you have a certain case manager inside the office that manages this, you know, certain number of patients, then you'd easily be able to identify who that is. There's also the ability to add an entire clinical team. Some agencies use this. To add a team, you can pick everybody that's involved in the care, and then you can put a checkbox next to who the primary discipline is, and then hit save, and then it will identify all the team members for this patient. Specialty skills, you can identify those here, and to add them, you click on the Add Specialty Skill link. These are customizable, these different skills for your agency and the settings. You know, but you may have a psych nurse, or you may have just a wound care nurse. What this really helps do is it's going to, for one, identify that this is a wound care patient, or pediatric, or psych, you know, whatever. And the other way that this works is you can actually attach skills to your nurses as well, or your staff members, and identify them as your pediatric nurse or your wound care nurse, so that when you go to schedule and assign these visits, it moves that clinician to the top of the list, saying that they're the best match. So this kind of works in two ways. You can track vendors. Your disaster plans on the transition patients, this would have to be entered directly on the clinical tab. On all your new admissions moving forward, this information actually will pull from your service note. But to add a disaster plan directly to the clinical tab, you just click on the Add Disaster Plan, and then you choose their priority level, level 1, 2, or 3, and then put in their specific plan details. Now, if your administrators add suggested text to the setting, you may see that found here. So it could be a template with all the information that they want you to make sure you have added. What you would be able to do is put a checkbox next to the disaster verbiage that you want, hit save, and then it will pull that verbiage into this this box here. You can still edit this information completely. So if you pulled in the verbiage and it had little low dashes or something where they need you to have a phone number or an address or something like that entered, you would be able to just come in here and completely edit that text as needed to make it patient specific, and then hit save. And you scroll down here, you can see that you're going to have your disaster plan level and your plan details. Now, this will pull to a global disaster plan report that your agency would need in case of an emergency. Consents and agreements grid here is if you uploaded, or if they uploaded consents and agreements or any of that and labeled it as one of these, assignment of benefits, patient signature, or release of information, it will update this grid and show you that it's been signed and when it was uploaded. So vital sign perimeters, this also works in a couple different ways. You do want to add them here, not directly in your order. These will flow to your 485s so that the doctor will still sign for those parameters. But the other way this works is if you're documenting inside your service note and you enter a vital sign that's outside of that range, it'll give you a little red icon next to that field, and it'll tell you, if you hover over it, what the range is supposed to be. It doesn't give you any kind of an error for when you try to complete your note or anything, because it could truly be outside of the range. It just gives you a heads up that you probably need to call the doctor. To add default vitals, you do need to come directly to the clinical tab and choose this Add Default Vital link. And it's going to bring up a list of all the vitals that we have in the system and then it's going to allow you to adjust the range. Now, it's going to pull this standard range from your settings, but you can actually make it even more patient specific. You can click on the up and down arrows, or just directly type in the numbers in this field. Some of these may not apply to your patients, like blood sugars, maybe not weights or O2 sats. So if they don't apply, you do need to hit save. And then while you're still here, go ahead and delete the ones that no longer apply. And anytime you delete or hit a trash can in the system, it is going to give you a confirmation. Are you sure you want to delete this? And you'll just confirm. That's important. Once something's gone, we can't always bring it back. Now, the vital sign parameters we could, but like if you deleted a service note out of the system, it would be gone for good. So just be very careful about anything you delete. And that's why we always give you a second opportunity to not delete it. If you did need to add some back in, you can just hit on this add vital, and then the ones that we removed would show back up, and you can re-enter that information and hit save. Okay. The DMEs over here, I do not recommend doing this for home health. This is more for hospice because they actually have to provide the DMEs, and these do not flow to your orders. So you do need to enter those directly on your order, or if it's a start of care and care efficient, you'll be able to answer the DME question inside your service note, and it will pull that information directly to your 485. Your advanced directive information, you can enter that here by clicking on that advanced directive, and you can choose what's appropriate for this patient. And then hit save. Now, for the advanced directives, you do need to go back to the profile tab. There's actually an advanced directive narrative, if it exists, that you can add here. So under this current encounter, if you were to choose edit, down here, there's the DNR status, and then there's also the advanced directive narrative. So if they're advanced directives, you know, pretty specific about stuff, you would enter that information here. Hit save. So once you do get advanced directive and DNR information in here, you do see that displayed up here, as well as in your service notes. When you, on the very first page, you do get their advanced directives, DNR status there, as well as allergies and a couple other information, functional limitations, etc. Okay. You can also track vaccinations. So if they had COVID vaccines or whatever, if you guys want to keep track of that information, you can just choose to add vaccine, pick which vaccine you want to add, the date that they got it, and then hit save. And then that information will show up here so you guys can look back to that. There is an option to add programs. Some agencies use this, some don't. You would have to enter programs in the settings. Some agencies offer specific programs, especially for therapies and things. You can identify that this patient is on that program that your agency provides, or some agencies actually use this for community-based programs like Meals on Wheels or adult daycares, things like that. Again, if they're added to the settings, then you would be able to choose those from a list and identify this patient as being on one of those programs. Over here where it says disciplines, this is just a quick glance. Every discipline that's been ordered is going to start showing up here. So you can just at a quick glance see that there's, you know, every therapy and nursing is involved in this patient's care. But that's just a, you know, coordination of care thing just to help you guys out. The meds tab, I'm going to spend a minute on the meds tab. It is, there's a lot to it. And the cool thing about the meds tab is you can actually enter your meds while you're documenting in your service note. There's a tab at the top, and I'll show you that on our next training when we go to add a service note. And it's a mirror image of this. So keep in mind while I'm showing you this, it works identically inside of your service note and simultaneously as well. So the different things you have here, you can add a medication, add medication kits. This is a little bit more for hospice. You can print the medication profile, approve the medication profile. You can fax this medication profile to a facility or actually anybody or anywhere that needs it. And then you can mass and activate, which is, again, that's a little bit more for the hospice side too, but we can go over all that. So to add a medication, you're going to click on this Add Medication link. Initially, you're going to choose whether it's a new or existing medication. Later on, you do have the option to change the dosage or discontinue the med. but initially it's going to be new or existing. You can type in part or all of the spelling of that med under the description and hit the little drop-down arrow. Now this is a Lexicon drug database. It's one of the biggest in the country. This is typically how these medications are manufactured and supplied. And sometimes, of course, you might end up with them taking half a pill or something like that. You want to, as best you can, pick the medication from a list here so that we can have information such as drug-to-drug interaction information, patient education information, etc. You can adjust this dosage if it really was prescribed or manufactured in a different way, or again, if it was supposed to be 1/2 of a tab, then you would write that information in the patient dosage and frequency box. The root will also pull from the med that you pulled in the drop-down box. You'll put the initial start date for that med. You can choose to track the type, whether it's alternative, herbal, over-the-counter, or prescription. Who's prescribing it, if applicable. Who's administering it, whether it's the facility staff, family, healthcare surrogate, or the patient takes it on their own. And you can add comments to these meds, but be aware these comments do flow to your 485 and to any medication orders that you guys may write, so be aware of that. Pharmacies, I'm glad you got some in here. These will show you what pharmacy is filling that prescription. Very, very helpful with coordination of care. If the physician was notified, you can choose which physician was notified. And approved by, you would choose your name. Now, if this is a start of care or this is a recert and you're addressing those meds and that 485 has already been created for the recert, then these meds will automatically flow to your 485 as well as a clinical update order. Now, if those 485s have been sent to the physician already and this is a new med after that start of care or the recert, you do have a little checkbox down here to create an interim order. And this will create a medication interim order, and it will pull all of this information into the order for you automatically. So then all you'd have to do is sign the order. In this case, I'm not going to do that since our 485 is open. If you have additional meds, you can hit save and add and go ahead and add the next med. But on your very last med, always hit the save and close, because if you hit the save and add, it's going to reopen this pop-up window. And again, you're going to have this orange asterisk, bare minimum information to move forward. Saying you're not going to have a new med, so you're going to have some issues. You can cancel out of it, but the meds may not be displayed there immediately. And then if I've seen it happen where a nurse thinks that they're not going to be displayed, they go to add the meds, they re-add them, and then when they save them, then they end up with all of them. So just to avoid any of that confusion or anything, you can just make sure you hit save and close on your last med. Now, personally, when I was a nurse out in the field, I would enter, 2 or 3 meds, hit save and close, and then come back and add 2 or 3 more, because I didn't want to have to re-enter 20 meds if there was some kind of a glitch or issue. That's just my personal preference. You don't have to do that. I'm going to show you, whoops, I already did that. I'm going to add a couple more meds here just to show you some other information. Okay, so those were 2 meds that I entered that the drugs were in the database. I'm going to show you how to override that, because sometimes you will have to do that. But real quick, so now that I got more than 1 med in here, if there is a drug-to-drug interaction, you're going to see this grid pop up below the meds, drug-to-drug interactions. It's going to tell you the severity level, major, moderate, mild, and between what 2 drugs. And then if you hover over this little icon to the right of the interaction, it will give you interaction information between those 2 meds. Now, this is medical terminology, nothing a patient would understand. necessarily, and then it does give you a lot of footnotes or reference material where they got this information. There's another way we can view that information actually print it off as well. But real fast, I do want to show you there are meds that are not in this drug database. Oxygen's the number one that I always tell the new agencies. It is not considered a med from any drug company. If anything, it's more of a DME. But you do still need to list oxygen on their med profile. So in those scenarios, and wound care supplies, et cetera, you could type in the name of that supply or the oxygen, hit the down arrow, and you'll see similar spelling meds, but you will not see oxygen in the list. So in this case, you would just click off of that, or if you already know oxygen is not in there, just don't even worry about hitting the drop-down box, and then come in here and start overriding and adding the required information. And again, you can fill out all the rest of this as well. But when you hit save and close on this, you're going to get a warning here that says the medication you entered cannot be found in the medication database. Click here to add the unknown medication to the encounter. So you're going to click on that, and then it's going to give you another warning at the top that says, warning, adding this medication will disable warnings and interaction information. That is only for this med or supply, because there is no information in the drug database, so we're just not going to have it. This will still flow to your orders and everything you need it to do, but we will not have patient education or drug-to-drug information available. So you'll just hit save and close after those two warnings, and then your med will be added here. And you can easily tell that it's been overridden because there are no icons under the alerts column. There's no printer icon. And then there's no, if you were to hover over this action item menu next to it, there's no patient education, and et cetera. But you do have to do that. I mean, like I said, oxygen is the number one drug or med. So that's how you'll add them. You can add medication kits. Again, this is a little bit more for a hospice, and you can see that the medication kits are set up for the hospice, but if any of these medications lists do apply to those patients, you do have the ability to add those specific med lists, and then you can uncheck what don't apply. Everything that's checked will be added. And they'll all have the same start date and entry type as well. So that's for a whole kit. Again, it's more for hospice. You do have the ability to print the medication profile. You can include the drug-to-drug interactions, the major interactions only. You can include inactive medications, classifications, pharmacy address, physician facts, date of birth, et cetera. And you can also enter them just with a start date greater than or equal to what date you enter in this field. And then you can hit export. It will open up a PDF format of that medication profile with everything that you asked to include on it. Your agency may be ask you to approve the medication profiles. I've seen this done a couple different ways. Sometimes they just do this on admissions and research, and sometimes they do this on every single visit, so that they're basically there's an audit trail showing that you are reconciling meds every visit. So you may be asked to do this every time, or it may be just certain visit types. But to do the approved medication profile, if you click on that, you don't have to pick your name from the drop down. If you hit enter approval signature and hit accept, it will automatically filter to your name. That actually works in the orders as well, so you don't have to just keep finding your name. If you see where it says enter signature, just click on that and it'll find your name for you. At this point, when you do approve medication profile, this is where you do have an opportunity to create an interim order for the major drug interactions so that you can send this to the physician if you're required to. And then you would hit save. You can enter additional comments in there as well. If there is an approval history, you will get an approval history drop-down box. and you'll see the who approved it and on what date. Now, since my screen is so zoomed in, you can't see it all in one field. But if you were to click on those, you can, again, just like if you were to print your med profile, you can print it with different information, hit export. Then it will show you what that med profile was at the time that you approved it. And it will show your signature attestation and when you approved this profile. It's a good audit trail, and it's a good way of just making sure people are addressing meds as they should. Now, when you first come to the meds profile, medication profile, it is going to default to just your active meds, and it'll remove the inactive meds. But if you needed to view those, you could filter to all, or you could filter to inactive, and then you'll see all of the medications. There is a mass inactivate. Again, this is a little bit more for the hospice side, but you could click on mass inactivate and pick all the meds you want to inactivate at one time. You can create an interim order for that, and it will end date them all the same day that you have up here. And then you would just hit save. Those are all your options up here at the top. Oh, besides fax medication. Now you can, again, if you hit fax medication, you can include all of this information and export it, and then you'll have the option to enter a fax number. You can put to the attention to. You can include text for the cover page. And then you'll see here, this is the med list that is attached. If you were to click on that, you could actually download it and look at it prior to sending it. So that's it up here at the top. The other things I'm going to show you here, they're on the alerts tab column. The left icon is going to be warnings for this medication, just for this specific med. Sound alike, look alike issues, international issues, et cetera. This is 11 pages long, and most of this from here down is all reference material. So quite a bit of reference material. This is medical terminology for the clinicians to view, not for the patient, or most patients wouldn't understand it. The orange asterisks, these are going to be food interactions for that specific med, maybe what to avoid, what not to change, et cetera. So this will give you the food interaction information for that single med. And then over here, this is why I like you guys adding pharmacies, because they could come over here and, they have an issue with the med. They need to call the doctor to get a refill. Maybe the clinician's no longer in the patient home. And if they don't have that information documented here, they may not know what pharmacy fills that. And then if you call the doctor, sure enough, he's not going to be in front of a computer, and he's going to ask, well, what pharmacy do they need to go to? This is how you'd be able this is how you would be able to identify that. Just click on that phone book, and you'll get the pharmacy address and phone number, fax number, whatever's available. You'll also, if that physician had contact information as well, you'll have that information here. These little upside-down black pyramid icons, I call those action item menu icons. If you hover over it, it gives you like another sub-menu. So if I hover over this one, I got the option to view side effects for this med, pharmacology for this med, and then there's patient education in English and in Spanish. Now, the side effects and pharmacology, again, those are going to be medical terminology, but the patient education, you can see here is in pretty layman's terms, easy to read and easy to understand. If this was a new med and you taught on that in your visit, you could actually highlight how far you got on what you taught about this med and document that in your narrative. And basically cut and paste that into your narrative if you needed to. There is a little printer icon, or there's other ways you can print this, just screen print. But you can print this off and leave it with your patient as well. Of course, you have to have a printer or access to a printer, or you may have to deliver it on the next visit, that kind of thing. So that's, the majority of this. Now, the other thing I want to show you, and it really works a little bit different after we approve our 485 and move on. But to discontinue a med or to change the dose of a med, you would come in here, click on the med, choose, instead of existing, you would choose change, Now, if you choose change, and then you put the start date, as for, we'll say today, for the new dosage, what it'll do is as of 4/5, it'll end date this original dosage, and then from 4/6 forward, you're going to have this new medication or the new dosage. So it will discontinue the old dosage and add the new dosage all in one step just by doing change dosage. Or if you discontinue the med, if it no longer is needed, then you choose discontinued here. You see that the orange asterisk showed up by the end date. You would throw in the end date and hit save. And again, you could create an interim order for that by checking that box and hit save. And that's how you would change the dosage or discontinue a med. Now, while you're, since this is a brand new patient that we're working with and the 485 hasn't been locked down or anything, the medications do have trash cans, so if you inadvertently added one, you could delete it at this point. But once it pulls to the order, once you save those orders, these trash cans will be removed, and you cannot delete them anymore from here until you go to the order, like your 485 or clinical update. You'll have the opportunity to delete it there, and then if you delete it off that order, then come back here, the trash can will show back up and you can delete it. So just be aware of that as well. So that's it with the meds tab. I know that's a lot of information, but the meds are real important, and there's a lot of functions here. The orders tab, this is where your 485 is going to be initiated and all of your additional orders will be written. This is where your OASIS is going to end up being added. Now, your OASIS, when you do a service note, it's an OASIS integrated assessment, and it's going to be added as a service note, and then it'll show up under the service notes tab. But what we do is we kind of pull just the OASIS questions out of that. So after you approve your start of care, then the OASIS will be managed from here and maybe reviewed. After things go to coding, everything's completed and it's ready to be locked, then whoever has that task will manage the actual OASIS from this part here. You guys, for home health, don't worry about services requested or the diagnosis code for paraprofessionals. You guys won't need to do that. All of your scheduling, order frequencies and durations and diagnosis will be entered on 485s. So you don't need to do that additional information down here. That's going to be for the caregivers. I'm going to come back to this orders tab because it's pretty lengthy as well, and I don't know if we're going to get a whole lot of time to go over all the different order types and stuff before the end of our session here. The payer tab. This I'm sure you guys probably will not be adding the payers, but this is where you guys can view the payers, and of course that really helps understanding what services you might be able to provide for your patients. The authorizations are going to be entered under the AUS tab, so if you guys do need to view that, you can click on the little icon. If it is incomplete or missing authorization, it would be red like this profile tab is on this one. But either way, if it's red or green, you can click on it and it will take you in there to view that authorization information. So if you guys needed that. Just a quick, just to get back to that inpatient encounter, instead of having to go back and search your patient or any of that stuff, there's a kind of a site map of where you're at in the system. So if you just back up one, you can go back to that patient encounter instead of having to research that patient. So this is where your payer information is going to be. The service notes, this is where they're going to be, not where you're going to enter them, but where you're going to be able to view them and do other functions. The service notes are really neat as far as you can, if a doctor calls the office and asks for, the blood sugars for the last month, the office actually has the ability to search the service note or filter it to just the blood sugars for an entire date range for that entire month or whatever was requested. And then they'd be able to export that information and send it to the doctor. So there's a lot of functions on here. I don't know that the field nurses would really use it much, but you just know it's there because if you're looking for certain information, it's going to be available here and easier to find if you search and try to filter to it. So, and we kind of got through that pretty fast. Before I move any forward, and just so you know, the EVV tab is just where EVV information is going to be gathered if you guys end up using any EVV transactions through the offline app. None of this information is editable, but it'll just show you, who did what and when, basically, for electronic visit verification. So before I move any further, this was just the overview of the patient encounter. We went through quite a bit. I know we haven't gone through order types. It's going to be in the next training. And how to add a service note, your normal day-to-days. I know that's, and we can actually cover some of that today, but I do want to give you guys the opportunity to ask questions before we move forward.
So what shows up on the information that we send to the doctor for medication interactions? I mean, are we sending him the whole page, 11 pages, or how do we notify the doctor about the
So for the interactions, again, you do, to actually create this order, this is the only way to create the interim order for the medication, drug-to-drug interactions for the major interactions. If you wanted to create an order specifically, an order for that. So this is what it'll look like. I'll go ahead and add one in there. And then we'll go to the Orders tab. And you can see that now there's a case communication that was entered. We can either click on the printer icon or we can go in here. It would need to still be signed by the clinician. It will pull their name from that approval signature, but you still need to assign this med. So choose enter signature, choose accept, but it will pull that interaction information. It's just going to say this is a major drug interaction between warfarin and aspirin, and then you can send this to the physician.
It won't say all the other stuff.
Huh?
It won't say anything else, just this.
Just this. The other information for that interactions, again, you can get it when you do the print medication profile. You can include all drug interactions or only the major interactions, and then you can also export this, and it will have that interaction information right here with, again, the reference material. So there's that way. Now you could copy and paste this into your order. The other option you guys could do is you could actually fax this and include those interactions, all of them or just the major, and then you could actually just fax this directly from here to the physician. The bad thing about that is you'll get a note under the Notes tab that shows that this was faxed. So just like this one, it shows that it was faxed and what was faxed. But I don't know. I think a lot of agencies prefer this method because this is managed with the orders, so they can make sure that it gets sent out, to the doctor. Now, case communications are just notifications to the physician. They do not require a physician's signature, but you do have proof that you did fax that to the physician if you do it this way, by doing the approved medication profile. So you have a couple different options there. Fax directly from the Meds tab, print it. You copy and paste that. You can copy and paste it into the order so you can have the exact information in there. But it does not pull that information into that order automatically, just the 2 drugs and that it's a major interaction. And then again, you can view that information here, and you can actually cut and paste it from here as well if you wanted to put that into an actual order. So I can come back to the Orders tab and come down here into the description and then just enter that entire information if you wanted to. So those are kind of the options you have. You're welcome. So we went through this pretty quickly, and there weren't a lot of questions, which is fine. We still have, about 25 minutes if you guys want to just kind of keep going. We'll end up talking about what we would have talked about on our next training. But that's not a problem. We can just kind of keep moving on. That'll leave the end of next training open for more questions, which I'm sure we'll have. So we'll move on a little bit. We'll talk about how to actually enter a service note. Now, this was an admission visit. Now, real quick, some of the options that you have when you click on visits, you do have this add note option. This is a scheduling note. These are extremely helpful for coordination of care, and I recommend using them. You don't have to, but I recommend it, and I recommend always reading them if somebody else added them to your note or to your service, because it's going to have important information. To add a note, let me just show you how that works first. You can click here, do add note. Again, this is not a service note. You can choose, and these options down here are customizable in the settings. But you can enter any information in here that you want to notify a person about their visit. So maybe you did wound care on a patient and used all of a certain supply. You can actually go to the patient's schedule and click on the following visit, 2 days later or whatever it is, and you can add one of these notes and say, hey, take out more 4x4s. I used them all. Maybe they have them in the car stock, maybe they don't. That'll give them a heads up before they even go to the patient's house that they need to swing by maybe and pick up some or make sure that they have some of that supply. Another thing that's really helpful, if the office received an order for a PTI&R lab draw that's due this day, of course you should be reading your orders, every one of them, and making sure you don't miss anything. However, it's beneficial also to have a heads up. So if I was to write that order, I'd go ahead and click on the day of that lab draw and give them a heads up and say, hey, this is a PTI&R due today. So number one, it lets them know that they cannot move that visit. If they were trying to manage their schedule and move it to tomorrow or the previous day, it'll give them a heads up saying you should not move this visit. The other thing that it does is, what was I going to say? It just gives them the heads up that they need to get that, supplies, in case they needed to go by the office to get the lab draw supplies. So it's very beneficial. The other times I use these notes a lot, we were on like recert visits that were in the 5-day window. I'd write in here, hey, this is a recert, and the end of episode is, 4/6. So you can't drag and drop that move visit outside of that 5-day window. So when the last day of the episode is, you have 5 days to get that recert done, and you can move it only within that 5-day window. So that's what these notes are really, really, really helpful for. And so if you have a note on your visit, you're going to see a little icon to the right of that patient's name. If you click on that, it will open up those notes that are in here. So there could be something about the schedule. Patient won't be DC'd until noon. So if this was an admit, you already know right off the bat, don't even try calling them until afternoon, and then plan your day accordingly around that. So view these notes. If they no longer apply, you could, as long as you have security permissions for it, you could deactivate these notes just like you do on the Notes tab. Or if it no longer applies, or if it's entered on the wrong patient, et cetera. And then, of course, you can actually view the inactive ones and reactivate it if needed. So those are scheduling notes. And it depends on if you have permissions to cancel the service. You may or may not see that. That would actually cancel the service off the calendar. And then you could create a missed visit order if needed. So to do that, if you were to get cancel, you can generate an interim order. And you can put in the pertinent information in this comments box. And this information will flow along with the date of service and your discipline to a missed visit communication that will go to the physician, so that you're staying compliant that way. But otherwise, normally you just kind of want to drag and drop those visits to the next day. You can just pick on it move it, drag it, drop it to the next day. You may get a warning if times overlap, things like that. But you can just move visits like that. Just drag them and drop them. Just be aware you don't want to drag it outside of a 5-day window, and you don't see the 5-day window from your associate calendar. On the patient calendar, it's actually color-coded so that you can see that that's a 5-day window. But on here, we can't because every patient, their 5-day window is going to be different. There's no way for us to be able to show you that. The other options you have when you click on a visit is you can view, print a blank assessment. If you were to do that, it will basically print a blank paper copy of whatever service note you're looking for. Now, if you were to do this from here, it will have that patient name, date of service, associate's name, all that already pre-printed at the top of the service note. So just be aware of that. Most people don't even really need to do that. I think that was available in case, back in the day we didn't have the offline app and things like that. And if they went to a service area that had no internet connection, they would have to print off a blank note, hand fill it out, and then scan it up, which is still doable today, but I think that's why that originally existed. Now we have better options. You can go straight to the patient schedule. So again, on your home screen, it's going to be your schedule with all the patients you have. But if your patient asks you, hey, who's coming and when, you can go straight to that patient schedule and be able to view, all the other disciplines that are involved and when they may be planning on coming. Of course, that's tentative. They may end up moving those visits around, but you can come in here and identify when their next visit is and discipline. And this is very helpful too when you need to add one of those scheduling notes to one of the follow-up visits to make sure they are aware to take out supplies or things like that. This is a way to get here so you can click on that follow-up visit. Again, you also have that option just to go straight to the patient encounter if you wanted to go straight to the encounter to view information or enter information directly in there. The edit service link is to change the service code. If you catch a mistake, and you guys are allowed to correct that or whatever, then this is how you could change the service code and reschedule it as the right code. Otherwise, you may just notify the schedulers and have them do it. This can be corrected all the way up until you verify the service. So even if you already add a service note and then you find out it's the wrong code, we can still change the code anywhere along the way until we verify the service. And that's going to be the last place to correct that or catch that. So we'll show you how to enter. We'll just go ahead and start with the start of care. So this is a start of care visit that I had added. I'm going to pick Add Page Service Note Assessment. And then you're going to get the option here, OASIS Integrated Assessment. This is going to be for any service note that an OASIS is going to be integrated with. So this will be your start of cares, your resumption of cares, your discharges if you made a visit and was able to do it that way. So this is going to be, adding the service note with the OASIS integrated into it. There is another way to add standalone OASIS as well, which is usually needed for transfers and some discharge where there was no visit made. Oops, I didn't mean to click on that. All of the follow-up visits, routine visits, all of those are going to be a regular assessment. So you're not going to have an OASIS attached to it. So this will be all of your routine visits. So we're going to start with the OASIS, and we'll cover some of these routine ones later. If you click on the OASIS Integrated Assessment, hit Continue, you're going to get the option, again, you're going to see your service note, that can be adjusted there. And then for a brand new admission and care efficient, you're only going to get the option for the start of care. Care efficient has logic built in, so it's time point sequence logic. So If it's a new patient in the system, you have to have a start of care before you can do a transfer. And you also have to have a transfer in before you can do a rock, things like that. So this is going to try to keep you as compliant as possible. So this being said, if you do not see the correct OASIS type right here, you don't move forward. Don't go ahead and add it. We cannot change your OASIS or any service note. Once you add it, you're going to be stuck with that note, or you're going to have to delete that note and then start from scratch and add a brand new note. So if you don't see the correct OASIS option here, you need to just stop right here, contact the office, and find out why. So on all the brand new admits, the very first OASIS, you're only going to have the start of care. On your transition patients, the only option you're going to have is the recert OASIS, which is going to be added as a standalone OASIS. If the patient was a resumption and you're looking for a transfer, that transfer needs to be in there before you have the option for a resumption. Again, you have to have them all in the right sequence. They don't have to be sent to state, but they have to be in the patient's orders tab before you can get to the next sequence, logical time point sequence. So just be aware, we can't change them. Hit save, and then that's going to bring you into the edit mode of your service note. The first section is the header and supply section. This is where you're going to end up entering your time in, your time out. It's going to calculate the duration for you automatically. Of course, normally you won't know your time out until the end of the visit. So when you get there, you would hit your time in. If you have any travel duration and mileages, that can be entered here. Now, if you do enter a mileage here, you do need to switch this to the mileage rate.
We are not, Brendan, we're not putting in the travel time and mile here, so we're not using that piece.
Okay. Okay, great. Okay, so that is not something that's required. The time in, time out is going to be required. So we'll come back to this section here in a little bit. I want to show you a few things about how these service notes work. Up here at the top, you do have this orders tab. This is irrelevant anymore because now we have the orders and care needs tab, which does way more for you. And on your starter cares, you're just going to get, what information. It's going to pull the verbiage and frequencies and durations out of the orders that you do have available, so you can view the verbiage. But it really isn't as helpful as actually going to the orders and care needs tab, which is actually a mirror image of the orders section of that orders tab. So you can actually view your orders here while you're within your service note. You can write orders while you're in here. Everything. And like I said, we are going to come back to the orders tab on our next training to go over different order types and stuff. But you do have, and this works simultaneously with the orders tab. So as you're making changes here, they're going to be reflected on the orders tab in the patient encounter. So just like the meds, I said this works simultaneously and identically. You can see here it looks exactly the same. So you can do the same stuff without leaving your service note. So then again, you can come back to the service note section. Now this is a starter care, so there are no previous notes. But if you wanted to view previous service notes and assessments and they are in a completed status, you would see a list of all of the service notes that are in here, the date of service, the clinician that did it, the discipline. You'd be able to view that information, and you can click on that previous service note and be able to just view all that information. Again, it'll open it up in another PDF, and you can just scroll through it and view it that way. There's the ability to change sections up here. There's a little drop down. There's a lot of sections in the starter cares, but you can change to flip to any section that you want to. If it is required, it will be red and say that it's required until you do enter information in there, and then it turns black, or actually it will turn green, and it won't show required anymore. If you were to try to save your service note without answering a required field, you will get errors, and I'll demonstrate that here in a minute. So you can flip sections that way. Every time you hit next or previous, it will save that information and then move you to the next section. So when you're on the very first section, you don't have the previous link, and when you're on the last section, you don't have the next link. So just they'll kind of change depending on what section you're on. Now, this is the OASIS Integrated Assessment, so this is the home health patient tracking sheet. This information is grayed out and cannot be changed directly in this because that means it needs to be fixed somewhere else in the system. So if the patient name is misspelled, before you can approve or before you do approve this service note, you would want to go correct the spelling on the patient profile tab. If their resident or zip code was wrong, or state or zip code was wrong, that would be pulling from the contact tab. If their Medicare number was incorrect, this would be pulling from the payer tab. Social Security is from the profile, date of birth from the profile, gender is from the profile tab. So, and then all the rest of this patient or agency identifier information, this is going to pull automatically from your agency settings. So you guys won't have access to change any of that. It should be correct. And then the MPI for the physician. Now I used a fake physician that had no MPI number, so it's going to give me this unknown. Of course, for all your true legitimate patients that require OASIS, especially Medicare, make sure that your physician MPI's number is up here. Otherwise, it does need to be added to the physician under the resources tab, and your agency administrators would have to do that. Now, some of this information may be pre-populated on these checkboxes based off what you've already entered somewhere else in the system. So I already chose my race and already added 2 different payers to the payers tab, so it already knows what payer category those are, and it pre-checked this. If any of this information is wrong, you can go ahead and correct it, but you should correct it on the, the payer tab or the patient profile tab as well. Anything that's a squared checkbox, these are multi-select, so you can select all that apply. There are other ones called radio buttons, the little round circles, kind of like these here. That's a single select, so you can only select one at a time. Some of this information is going to automatically pre-populate, but if this is incorrect for any reason, you do want to get the correct information in there so you can make adjustments if needed. There is also skip logic in here and things like that. So if you were to enter a, certain things, you know how in the normal OASIS it says if you answer this, then skip to that other MOO question or MO question. So we will remove that automatically for you. So like here on episode timing, you can see these are radio buttons, and they're a single select, so you can only pick one. Other things we can do in here for diagnoses, I know you guys will have coders. To be able to approve your note, you do have to enter a diagnosis code in here. So I don't know if your agency is going to give you a generic one. But the way to do that is if you enter that ICD-10 code, hit the drop-down button next to it, and then it's going to filter all of your 72,000 diagnosis codes down to the one, and you can just click on that. And then at this point, you can do an onset exacerbation date, and then you do have to enter a date here, even if that's going to be changed or even if this is a fake diagnosis. Okay, so at least get the primary in there. You don't have to worry about any of the rest of them. There is the ability to add up to, I believe, 25 diagnosis codes. Of course, only the top 6 get transmitted with the OASIS, but this will allow you to enter all the additional diagnosis codes if you knew them, and these would flow to your 485. So let me kind of get towards the integument questions on it. There may be links, and we are still making some tweaks to the service notes, but there may be links that says copy previous data in there. If there's a completed service note but prior to the date of this service note, and you have this copy previous data link. If you were to click on that, you'd be able to see a list of the notes, and you can pick the most recent service note of your same discipline, and you can click on that, and it will actually copy that information in here and pre-fill this out for you. Now, of course, this is a start of care, so there's nothing else or no previous data, but we do have the option to turn that on or off, depending on what your administrators request. Let me skip to the vitals. Now, on the vital signs, again, if you entered a vital sign outside of that range that we set up under the clinical tab, you will get a little icon next to it, little red icon with an exclamation point, and it'll say, hey, the temp should be between 96.5 and 101. This could truly be the temperature. It's just giving you a heads up that you're outside your range. You probably need to call the doctor. So that's how those work. Let me kind of move down towards integument. Okay, so there is, under the integument assessment section, there is an add edit wound assessment link. If you were to click on that, it does bring up the body, the human body. And you can just click where those wounds are, choose your location from the drop-down list. And again, these locations are even editable in the settings. And then document the description of the wound here. Now these will label them, number 1, number 2, sequentially as you order them. And then it'll give you that verbiage up over here. And these do flow from service note to service note to service note. So as you make changes to this human body and the wound descriptions, they will end up flowing into the next note. So if this was a follow-up visit and I came into the integument section and clicked on this, I would see what the admission visit had documented here. Okay, and I can make other documentation changes if needed. If the wound has healed, you can click on the document description up here, the word, everything that's basically orange font is going to be a link, just FYI. But if you click on that, it will pull this up. You can edit that description if needed, or if it resolved, you can hit the little is resolved checkbox and hit save, and then it will change that from red to green. So all your green ones will be resolved, all your red ones are unresolved. And when it first comes here, it will default to all, showing all of them. But you can filter it to just showing only the unresolved, or if you just wanted to see resolved, you could do this as well. And then you can just close out of that. So that's how that works. The other thing with the integument section is we strip out all the wound care documentation other than the wound care education section because patients may or may not have wounds that you need to document against. If they do have wounds, we have this function called Apply on Demand sections. And the way these work is you click on the Apply on Demand. You're going to see a list of everything that's available. So right now we have the diabetic foot exam as an on-demand. IV therapy and injection, lab, mini mental status are all on demand, and then all of your wounds are on demand as well. So you would pick the wound and the wound types and the number of them that you need and hit save. And then now that puts these sections into the service note. So those sections weren't there previously, but now they are here. So you can document against those wounds. Now these will automatically flow into the follow-up service notes. But the thing is, if you guys save and close your service note without documenting anything in these sections, when you come back in to edit your service note, those sections will be gone and you need to re-add them. So I do recommend at least documenting something once you add them. Just put something in there. You can finish the documentation later if needed. And I believe we're going to make changes to the way that works later. Now that I have some information in here, it may be really hard to see, but this vital signs, the font is actually green and everything else is black. And it's kind of hard to see maybe, but that means that information was entered into that section and saved. Doesn't mean it was complete. It doesn't mean it was correct or accurate, but some information was saved into that section. And the way that kind of helps is if you were to, of course, with a start of care, you may not be able to document the entire start of care from beginning to end inside the patient's home. So a lot of the times you're going to have to save and close the service note and then come back in to edit it. And if you do that, you can see where you left off because all these top ones will be green all the way down to here, and then all the rest are black. That's just a real obvious sign that that information, that's where you need to pick up where you left off. And again, you probably need to double check everything's still correct and accurate and got saved in those other sections as well. But that's another thing, that another function of these service notes. And I just wanted to show you, I know we're out of time now, so I just wanted to show you one other thing while we're still in here. Oh, sorry. There's all the view wound assessment link as well. This will bring up a PDF version of that link as well. So it's just another function. Once there is information in there, you do get this link to view it, or you can go in there and add and edit it. So then here's the wounds that I added. And so they're pretty lengthy. I mean, you have the location, the type of wound, all your measurements, all the descriptions for everything. And then it has the wound care information as well. So what topicals, how'd you clean it, what topicals used, what dressing was applied, secured with, all of that information in here. So the reason that we strip them out is because that is very, very long, and you saw how many wound care sections we have available. So if the patient doesn't have wounds, you don't want to have to sit here and hit next, through 40 sections. And you remember I talked about skip logic. So if you answer these certain ways, which would normally require you to skip to a follow-up question, it will remove those next sections. This one's not one of those. I was trying to find. Well, the other one that's real, I mean, you'll notice it when you're in there. I was trying to find the OASIS questions about wounds, about ulcers.
Yeah, it's the pressure ulcer section, yeah, that I'll skip.
Okay, and then another thing, there's locators that are in these sections. If it says LOC in front of it, and then there's even some that don't say LOC, these locators actually pull to different areas. So it may pull to the clinical tab and then the orders, or it may pull just straight to the orders. So like your diet here will pull automatically to your 485. So as you answer these questions in here, these will flow automatically. There's literally almost no double documentation in CareEfficient. So just be aware of that. Where is the pressure ulcer assessment? Here we go. So like this. So if you answer no, you normally skip 1311. So I'll say no. It just completely hides it. You don't even see it anymore. So it keeps you guys on track by removing those questions. You don't have to read, okay, I need to skip to this one. This will just straight up remove the ones you need to skip so you can move forward. So it's really, really helpful so you don't have to keep track of that information. Now we're out of time, so I'm going to just save and close this note, and we can come back and finish these out on our next trainings. So do you have any quick questions for me now? Or again, we kind of went through this a little bit fast, so we'll have more time for questions on the next meeting as well.
Okay, thank you, Brendan.
Absolutely. No problem. All right, you guys have a great day, and we'll talk to some of you here pretty soon.
Okay.
Thank you.
Awesome.
So that apply and demand that